Well, if you've ever had a migraine, you'll know it is no ordinary headache. For a start, there's that pounding. The tiniest whisper can really hurt your ears, and the lights, they can really hurt your eyes. And then there's the nausea and vomiting that can make you just want to curl up into a little ball and stay there until it all goes away. Sound familiar? I'm not surprised. Up to 3 million Australians are suffering migraines at any given time, and over half of them are women. Len, I'm a GP. I must hear about people's headaches all day, but a lot of people say, I've got a migraine, but not all headaches are migraine. I mean, how do you tell the difference?
Well, migraines are typically single-sided, usually either left or right-sided. They're throbbing in nature. They're often associated with visual disturbance, so people can see multicoloured lines around objects, they can see gaps in objects. They're often associated with nausea, sometimes associated with tingling around the mouth or in the hands, and the inability to look at bright light or to be in an area where there's bright light.
Do you tend to find that there are certain things in common that tend to set off migraine patients?
Migraines are commonly set off by stress, but a chronic migraineur, someone who's had migraines for a long time, will often find their headaches just occur quite spontaneously.
Migraines affect a whopping 16% of Aussie women and 8% of Aussie men. Now, for the vast majority of them, a simple over-the-counter or even a prescription medication from the GP will fix them up and they'll be on their way. But for 38%, that's not the end of the story. They're going to have such frequent migraines that they need some prevention. Now, we do have medications and they do work well, but they don't work well in everyone and there are side effects. Lorna, you've been managing your migraines for about 16 years now. How did it all start?
About 17 years ago, I had an aneurysm burst in my brain, and after surgery to clip that, I had a stroke, and after all that happened, I now suffer migraines. I can get them once, twice, maybe 3 times a month, if not more.
So how long do they tend to last?
They were only lasting in the beginning a couple of days, but they have gotten longer. They last about a week now.
How have those migraines impacted your life?
Your life just stops. It just totally shuts down and you can't plan anything. You can't plan to do anything. It's like people invite you to a barbecue. It's like, I'll be there if I don't have a migraine. But you just have to sort of curl up in bed, knock yourself out, take some painkillers or some beta blockers and sleep it off.
Unfortunately, we still don't have a cure for migraines, so for managing them for most people, it's going to be a matter of trial and error, different medications to see what works. But for some, with more severe migraines, they're going to start looking outside the box. In your experience, which are the best? What sort of medications really work?
There are now very good medications for the management of migraine, going from the serotonin inhibitors, the drugs like Migraine. We've got migraine preventative medication, including some of the anti-epileptic drugs, which are very effective in helping to control migraine. Then you start looking at the non-pharmacological approaches to pain and to migraine in particular. So we look at relaxation techniques. Hypnosis can be very effective in the treatment of migraine. Aromatherapy, lavender and peppermint. Acupuncture can be used both for pain control and also as a means of relaxation. And of course, we now have this class of treatment that I think is really exciting, and that's the introduction of an old technique but in new guise, and that's the Cefaly device.
The Cefaly came to Australia in 2013, and I've been using it since May 2013. I've been using it about 74 patients so far, and it has been having a good response in the majority of those patients. The device works well when you make the correct medical diagnosis of migraine and you choose the appropriate patients. It's not for all migraineurs. Some migraineurs are very sensitive for even touch, and some might have other medical conditions. So you need to choose the right patient, and once you choose the right patient, then we find the results are moderate to very good, especially with patients who are having migraine with aura.
The Cefaly device is a very simple electronic device that builds on the principles of transcutaneous nerve stimulation, where we apply electricity to the skin to convince the nervous system to switch off pain. This device is worn as a headband. It's a very, very futuristic looking headband which has a single button that people can use to control the programming in the device. 3 programs. The first one stops the headache while the headache's going. The second program actually prevents the headaches from coming. And the third program adds the relaxation that a lot of people with migraine require to both prevent their headaches and help them to manage their headaches. Like all treatments, Cefaly may have some side effects, some problems for some patients. I think particularly some patients do develop a sort of skin allergy to the electrode. The electrode's a very small sort of object. It only covers an area between the eyebrows. But for some people, that'll be enough for the contact to cause an allergic reaction. Very rare, but it does happen. Some people won't like the sensation, won't like the tingling. Some people will say it's too much like their migraine, but I can't really see any other major side effects. What I can see is that it'll help people to reduce their medication in many cases, or it may just work together with that medication to give them a better result than they were experiencing previously.
I've been using the Cefaly device since about March 2013. It definitely has made a world of difference. Not only has it helped me sleep better, but with my migraines, they certainly haven't been as frequent since I've been using the Cefaly device.
So if, like Lorna, you or a loved one are having migraines that are proving just too hard to handle, do have a chat to your GP, because there might just be a treatment out there that you haven't tried yet.